Good morning. Are you looking for a breast implant and you are confused as how we plastic surgeons would select the best breast implant for you? How do we select what size is good for you, what projection is good for you? So this is going to be a great video for you to have a basic understanding of how breast implants are sized, what different projections are available. So keep watching this video and I'm sure this will add a lot to your knowledge about breast implants. My name is Dr. Amit. I'm a plastic surgeon with an 11-year experience in the field of breast cosmetic surgery. So let's move on this. The first question is 90% of the time about cost, and my previous video about the cost of a breast implant talks about how we decide the costings and what breast implants generally what would they cost. So moving ahead, cost, like I always say, cannot be a criteria. What is important is what do you want? What does a patient want? What does you as a woman want? So my subsequent videos will talk about different categories, different people. For example, women who are in the fitness fashion industry, women who are in the acting or the modeling category, housewives, adult industry, adult entertainment industry. So I'm going to be talking about how measurement, how planning of breast implants is very different for all these different categories of people. Now, important thing about breast implants that one needs to understand is what is projection, what is base diameter, how do we measure the breast, why in some patients you may not get cleavage, and why what you think of breast implants when you see them in the media are not exactly how it happens. So we're going to talk about some of these, and you must I strongly suggest that you subscribe to this channel so that you get notifications of the subsequent videos that I'm going to be shooting up as well. Just click the red bell on the top and subscribe to this as well. So this is a breast implant. Now different companies, Mentor, Sabine. Mentor does not come in India, but we've got Sabine, we've got Motiva, we've got Negor. So they're all pretty good implants, and then we have some of the Chinese brands as well, which I personally do not recommend. Now this is a 350cc Sabine implant, and this is a 275cc Mentor implant. Now I'm going to put them together. So what you will see is that there's a difference in the projection. So what is a projection? A projection of an implant is the amount that the implant is able to project the breast or the cup size. So basically the cup size is the projection. So how much is the height like this, or if I keep it on my chest, how much is if I'm going to move laterally, how much is this going to come out by? So this is called the projection of an implant. Now, very simple ways of how we are deciding the size of the implant. So I'm just going to draw out a picture of a breast, and so for example, if this is the right breast and this is going to be the left one, this is going to be the center portion of the chest. So what we do is we measure the diameter at the level of the nipple, the breast. So first we define the breast dimensions, then we calculate this breast diameter. We also calculate, I'm sorry for the lines not being straight, but then we calculate the vertical diameter. Finally, we also calculate a third parameter, which is the breast volume. So there's a separate measurement available for that as well. That becomes very essential. Now understand this, and it's very easy. So we calculate this breast diameter, and that breast diameter is going to be the same as the diameter of this implant. It cannot be larger or it cannot be smaller. If it is smaller, the breast is not going to be as firm, and if the implant base is going to be larger than the breast diameter, then it will look abnormal. Then you will see the edges of the implant on the sides. You will be able to make out that the patient has an implant. So this has to be an exact fit. So for example, suppose this diameter is 10 centimeters and my implant is 9.9 or 10.1 in its base diameter, then it's a perfect fit. So then we decide, and the base diameter gets fixed. So once we've decided on the base diameter, then for me that is the number one criteria of how to select a breast implant, the base diameter of the implant. So once we've actually done that, then we talk to the patient of what projection are they comfortable with. For example, there are implants with a certain base diameter. They may come as less projection, more projection, and a lot of projection. So you understand that they may be slightly more flat, they may be normal, and they may be high. So these are basically profiles. So there may be a moderate profile, there's a high profile, and there's an ultra high profile as well. So for the same base diameter, the company may fill the implant more, and therefore you get a higher projection, ultra high implant. The company may fill it less, so it's a high profile implant. They may fill it lesser, so it's a moderate profile implant. So in my subsequent video, I'll talk about what profiles work for what kind of people, and then we'll do the reverse. We'll look at situations of certain categories and then fit the profile of the implant to the profile. So the next video is going to be about breast sizing. A lot of women unfortunately do not know about breast sizing and sizing of the implants. So that's going to be the next one. That's going to be a quick video. And subsequently, I'll then be talking about what profiles fits what kind of people. So that's a short video of how we decide the size. And I strongly always recommend that please go for the best quality of implant that you can afford. And because it's once in a lifetime procedure, these implants come with lifetime warranties only if they are good quality implants. So do not compromise with this at all. Yes, I can understand that your budgets may be a little lower. Please save money for a few months and do a better quality implant, or you can do an EMI. Now we at Divine Cosmetic Surgery have tie-ups with NBFCs, and EMI options are also available for breast implant surgery. So explore that as well, but it's a sincere request that please do not go for cheap quality implants. So have a great day. I would request you to subscribe to this channel. It helps me know more. The more the people that are attached, the different questions which come up helps me with the questions that people want to ask, and these are the questions which I can then answer, and I'm sure these questions and answers will help you as a patient. So keep watching these videos and my series, and have a great day.